Senators will take up those nominations at 4:30 with votes at 5:30 Eastern Time. Over on the other side of the Capitol, the House will be coming in at 2 o'clock as well today, working on some suspension bills, including one that would open the Southwest waterfront in Washington, D.C. to development, and using the Capitol for upcoming public events.
The Senate will come to order. The chaplain, Dr. Barry Black, will lead the Senate in prayer.
Let us pray. Eternal Spirit, the center of our hope, we know our needs. Life has taught us that we can't walk alone. So be with our lawmakers to help, to comfort, and to sustain them. Lord, guide them through the changes and chances of their labors. Whatever light may shine or shadows may fall, empower them to meet life with a steady gaze, to walk in strength, wisdom, purity, and joy. Create in them a passion to do what is right, and give them the ability to do it. As they seek to live with honor, may their thoughts, words, and actions bring glory to you. We pray in your sacred name. Amen.
Please join me in reciting the Pledge of Allegiance to the flag. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. The clerk will read a communication to the Senate.
Washington, D.C., May 7, 2012. To the Senate. Under provisions of Rule 1, Paragraph 3 of the Standing Rules of the Senate, I hereby appoint the Honorable Richard Blumenthal, a senator from the state of Connecticut, to perform the duties of the chair, son Daniel K. Inouye, President pro tempore.
The Majority Leader.
Thank you. We're now concerning the motion to proceed to the Stop Student Loan Interest Rates Hike. At 4:30 today, the Senate will proceed to executive session to consider 3 judicial nominations, the Nguyen nomination, a Ninth Circuit nominee, the Baker and Lee nominations, which are 2 district court nominees from Arkansas and Illinois. At 5:30, there will be up to 3 roll call votes on confirmation of the nominations. Mr. President, a woman from Nevada by the name of Amy Riley, in fact, she's a single mother from Las Vegas, was devastated when she was laid off 3 years ago because of her employer having little work. She was in love with her job doing bookkeeping for a local construction company, but she loved the steady paycheck. So looking back on that pink slip, Amy views it as, of course, a setback in one sense, but really she feels very good about the fact that it gives her a second chance. Like many resourceful Americans who lost their jobs after the financial and housing markets collapsed, Amy took the opportunity to return to school. She enrolled in classes at the College of Southern Nevada and completed her associate's degree at the age of 33. Going back to school really transformed her life. She got involved in the political process, and this was for the first time. She and the whole time at school made straight A's, 4.8 grade point average, and was elected student body president. But she's also racked up a $20,000 student loan debt. Amy doesn't regret the decision to go to the university. Not only has she gotten a second chance at college, she has shown her 14-year-old son the power of education. Still, working 3 part-time jobs and living on a few $1,000s a year hasn't been easy, and that's an understatement. And it would have been impossible for her to get her education that she's gotten so far without student loans. Amy will need more loans to complete her bachelor's degree at the University of Nevada at Las Vegas, where she starts classes this fall. For most students, taking on debts is the only way to turn dreams of higher education into reality. The average student graduates with $25,000 in debt. And on July 1st, the interest rates on federal loans are set to double for more than 7 million students. Unless Congress acts quickly, rates will jump from 3.4% to 6.8%. That will cost Amy and millions of other students at least $1,000. For a single mom working 3 part-time jobs, $1,000 is the difference between completing her bachelor's degree and simply stopping school. In Nevada, higher interest rates would affect 26,000 students. College is already unaffordable for far too many Americans, and we can't afford to put higher education any further out of reach. So Senate Democrats have introduced a proposal to freeze student loan interest rates at current levels for a year without adding a single penny to the deficit. Democrats will vote to advance that proposal tomorrow before noon, and we hope Republicans will join us. Mr. President, Republicans claim they share Democrats' goal of protecting these 7 million students I've talked about from these interest rate increases. We'll see. They insist we should pay for this proposal with unreasonable cuts to preventive health services for millions of Americans. This is a program that is so vitally important to the health care delivery system in this country. Senators Mikulski and Senator Harkin and others have really worked very hard to maintain this program. It's so essential. Republicans know their proposal would never pass the Senate, never. And President Obama has said he would veto more cuts to crucial preventive health care. But there's already a compromise that's on the table. Our legislation closes a loophole that allows the rich to avoid paying taxes they already owe. Our proposal is not a new tax, Mr. President. It would simply stop wealthy Americans from dodging the taxes they're required to pay. If Senate Republicans are truly serious about protecting 7 million students, they'll work with us to pass this reasonable proposal. Mr. President, I ask unanimous consent the Senate proceed to executive session to consider the following nominations, counted 512 and 513, that the nominations be confirmed en bloc, the motion to reconsider be considered made and laid on the table with no intervening action or debate, and that no further motions be in order to any of the nominations, and any related statements be printed in the record, that the President be immediately notified of the Senate's action, and the Senate then resume legislative session.
Is there objection? Without objection, so ordered.
Would the Chair announce the business of the day?
Under the previous order, the leadership time is reserved. Under the previous order, the Senate will resume consideration of the motion to proceed to S-2343, which the clerk will report.
Motion to proceed to calendar number 365, S-2343, a bill to amend the Higher Education Act of 1965 to extend the reduced interest rate for federal direct Stafford loans and for other purposes.
President.
Senator from Iowa.
Mr. President, parliamentary inquiry. We are now on the Stop the Student Loan Interest Rate Hike Act of 2012. Is that not correct?
We are in the motion to proceed to that measure.
Well, Mr. President, I yield myself such time as I might consume then.
Without objection.
Mr. President, I can't emphasize strongly enough the importance and urgency of the legislation before us, the Stop the Student Loan Interest Rate Hike Act of 2012, which the Majority Leader just spoke about. On July the 1st, unless Congress intervenes, the interest rate on federal student loan debt is set to double from 3.4% to 6.8%. More than 7.4 million American students, including an estimated 255,000 students enrolled in Iowa colleges and universities, would be required to pay an average of $1,000 more per year of school. The bill before us is straightforward. It's fully paid for. It keeps the interest rate at 3.4%, and the cost is offset by closing a tax loophole that benefits certain high-income professional service providers. I would like to thank Senator Reid for his leadership in advancing this critical legislation. I also thank President Obama for making this legislation an urgent priority and for visiting college campuses across the country to speak out on this urgent problem facing our nation's students and their families. In today's global knowledge-based economy, an education beyond high school is no longer an option, but it's a necessity. A worker with a bachelor's degree makes 85% more on the average than a high school graduate. Almost two-thirds of the job vacancies between now and 2018 will require some post-secondary education, and more than half of those will require at least a bachelor's degree. As you can see by this chart, right now, as I said, 63% of the jobs will require at least some college education, either college and associate degree or a bachelor's degree or more. That's just by 2018. And the demand is going to grow even beyond that. These statistics convey a very clear message. Higher education is a key to not only entry into the middle class, but a middle-class life. Another message is equally clear, and that is America's economic competitiveness and growth depend on a highly educated and highly skilled workforce. That's why the ever-growing mountain of student loan debt is a major concern for me as the chair of the Health, Education, Labor, and Pensions Committee, and also a major concern for families all across America who are struggling to get by. It's a shocking fact that total student loan debt now has surpassed total credit card debt for the first time ever. $867 billion right now in student loans. Auto loans, $734 billion. Credit cards, $704 billion. So the first time ever, student loan debt, they now owe more on that than they do on their car loans or on their credit cards. Now, again, I want to bring this more closer to my own home. It affects Iowans very profoundly. Nearly 72% of Iowa college graduates have debt, the fourth highest percentage in the nation. And those borrowers have an average of $30,000 in student loan debt, which is the third highest level in the nation. Now, over the past 3 years, President Obama and Congress have taken robust steps to improve college affordability and help our students succeed. From the Recovery Act and its unprecedented support for our education systems, to the student loan reforms that enabled us to help more students through larger Pell Grants, and most recently, efforts to make it easier for students to repay their loans. This all happened just in the last few years. We've made major strides toward the President's goal, and I hope it would be our shared goal, of reclaiming America's standing by 2020 as the country with the highest proportion of college graduates. Needless to say, it will be much harder to reach this goal if Congress allows interest rates to double on July the 1st. As I said, more than 7.4 million American students would be required to pay an average of $1,000 over the lifetime of the loan for each year that they borrow. So again, if you look at this chart again shows what's happened. If the interest rate is paid at 3.4%, we're looking about $883 in interest over the life of the average loan. You double that interest, it goes to $1,876 at 6.8%. So the average savings to the average student would be almost $1,000 a year. And I might just add that the 255,404 borrowers in Iowa will save an estimated total of $254 million with this bill in front of us. With today's tough economy and given the very high unemployment rate among young Americans, it's unacceptable to ask middle-class families to shoulder sharply higher student loan interest payments. We must not allow this to happen. If you look closer at the characteristics of students who will be impacted by this interest rate hike, you see that it really affects middle-class families and vulnerable students from disadvantaged backgrounds at the very time when they're under enormous financial strain. If you look at who gets the subsidized loans from this chart, you can see that by family income, dependent students, their family income is less than $60,000 a year. Less than $60,000. If you look at the independent student loan borrowers, their income is less than $50,000 a year. 89% of them is less than $50,000. And those dependent student loan borrowers from families, 60% are from families that have less than $60,000. And I might also add that 7 out of 10 of those independent students here, 7 out of 10 reported under $30,000 a year in income. Under $30,000 a year in income. So allowing the interest rate to double would also disproportionately affect minority students who account for 40% of these borrowers. So 40% of these borrowers are minority students. This bill, again, would prevent the interest rate from doubling on July the 1st for those borrowers. So with the bill before us, we're considering a pragmatic and fiscally responsible solution to this problem that will keep interest rates low for more than 7.4 million students. Again, the bill is fully paid for, and we offset the cost by raising revenues in a way that will provide a solution to a long-standing problem in the tax code that has been subject to widespread abuse. Now, let me just define how this measure is paid for. For many years, we have seen avoidance of properly owed Social Security and Medicare taxes by some Subchapter S stockholders who can declare that a portion of their income is effectively profit and therefore not subject to Social Security or Medicare taxes. Now, this is not supposed to be a choice that is made at the whim of the taxpayer. It should be based on objective facts. The offset in this legislation does just that. It creates a bright line test for a small share of Subchapter S shareholders, basically those engaged in professions such as doctors, lawyers, accountants, consultants, and lobbyists, whose financial gains, the financial gains they have come from the work that they do. It's narrowly tailored to cover only those Subchapter S organizations in which there are 3 or fewer stockholders, and only for those earning $250,000 on joint filings. With this bright line test, the Medicare and Social Security Trust Fund will receive the funds that are properly owed to them, which are not received today because they're counted not as an income but as profits. Now, my friends on the other side of the aisle have proposed a different offset to pay for keeping the interest rate at 3.4%. The bill that passed the House of Representatives and the legislation proposed by Senator Alexander of Tennessee would offset the cost of this bill by eliminating the Prevention and Public Health Fund, which was created by the Patient Protection and Affordable Care Act. In short, rather than put an end to an abuse of the tax code, My friends on the other side of the aisle are proposing that we eliminate the sole dedicated source of federal funding for investments, critical investments, in preventing disease, keeping women and children and elderly families healthy. They want to eliminate the Prevention and Public Health Fund. Mr. President, many of my Republican colleagues have acknowledged the critical importance of investing in prevention and wellness, which makes the use of this offset, that is, eliminating it, all the more troubling. Preventing disease, expanding access to screenings, encouraging people to stop using tobacco. These used to be bipartisan goals, strongly supported by a vast majority of Republicans and Democrats alike. So in the Affordable Care Act, we created the Prevention Fund with the express goal of ramping up our investments in these prevention and wellness initiatives, again, with Republican support. Just quotes from two Republican leaders. Senator Kyle on 7/12/2010, when we were in the midst of debate on the Affordable Care Act, said one of the things we did in the health care legislation was to provide a lot of different incentives for preventive care, for screening to try to help people avoid illnesses on the theory that it would be a lot cheaper if we didn't do a lot of treatment that was unnecessary. I couldn't agree more. The Republican leader, Senator McConnell, said the same year, 2010, Congress should be able to work together on our practical ideas that the American people support, such as encouraging wellness and prevention programs that have proved to be effective in cutting costs and improving care. That was just 2 years ago. Well, yeah, less than 2 years ago. But now, Republicans are making outrageous partisan attacks on the Prevention Fund. I find this deeply disturbing and disappointing. It's not hard to imagine the message gurus, those that hone messages, telling Republicans, here's all you got to do. Just smear the Prevention Fund by calling it a slush fund. How many times have I heard that? The Prevention Fund is a slush fund. I've heard it in committee. I've heard it on the floor. I've seen it in print. Republicans calling the Prevention Fund a slush fund. Well, this is shameful. That term, slush fund, is a malicious untruth. Nothing could be further from the truth. The truth is that the Prevention Fund has been a giant step forward for public health in our nation. Typically, prevention and public health initiatives are an afterthought. This means that important community-based interventions often go unsupported. The Prevention Fund is making it possible for us to make national investments in evidence-based programs that promote physical activity, improve nutrition, reduce tobacco use. Well, these are the investments that we make. This Prevention Fund, which the Republicans want to eliminate, invests $226 million to reduce chronic diseases, including diabetes and heart disease. That minimizes the $440 billion a year in health care costs from heart disease alone. It invests $93 million for anti-tobacco education and support campaigns to minimize the fact that over 6 million kids will die from smoking if the current rates persist. It invests $190 million for childhood immunization programs, again, to minimize the $3 billion a year in unnecessary health care costs right now. I might just add, Mr. President, the lead editorial in today's New York Times said no longer just adult onset. That's the head of it. So the virulence of type 2 diabetes in children is yet another reason to fight childhood obesity. I won't read it all, but I think there's a few pertinent paragraphs here in the Times editorial today. Starts off by saying a study of diabetes in overweight and obese youngsters bears an ominous warning about future health care trends in this country. It found that type 2 diabetes, a new scourge among young people, progresses faster and is harder to treat in youngsters than in adults. The toll on their health as they grow older could be devastating. This new study was published in the New England Journal of Medicine. Some experts suggest, reading further from the editorial, that young patients at risk of diabetes need to be detected earlier and treated more aggressively. But the long-term goal should be the prevention of obesity and diabetes. Congressional Republicans, the editorial goes on, meanwhile are bent on dismantling health care reforms that could greatly assist in curbing the obesity epidemic. The Republican-dominated House last month narrowly passed a bill that would eliminate a prevention and public health fund established under the reform law, in part to pay for lowering the interest rate on subsidized student loans for this year. The fund is already providing grants to state and local governments to help pay for programs to fight obesity and prevent chronic diseases, including diabetes, in the community, the workplace, and among minority groups that have high rates of both obesity and diabetes. Killing off this program, the editorial goes on, would be hugely costly to Americans' health and future health care costs. There is no explanation for this move, except for the usual anti-health care reform demagoguery. Demagoguery. Mr. President, I ask consent that this editorial appear in its fullness at this point in the record.
Without objection.
Well, Mr. President, I don't know that I can make it any more clear than the New York Times editorial, but there's not the time to mention all of the ways that this fund is already making Americans healthier. But I want to mention just several representative investments that are happening, again, right now. I mentioned those right here, the $226 million on diabetes and heart disease, the $93 million for anti-tobacco education, the $190 million, again, for childhood immunization programs. I might just go back to that first on the heart disease, because heart disease disproportionately affects women. Most people don't know that. I think most people would say the #1 cause of death in women today might be breast cancer. Not so. The #1 cause of death for women in this country is heart disease. Some 42 million women are currently living with some form of heart disease in America. And the World Health Organization estimates that a staggering 80% of heart disease, diabetes, and stroke could be prevented just from changes in smoking, nutrition, and physical activity alone. 80%. That's what this prevention fund is doing right now. And moreover, this investment by the prevention fund isn't only saving lives, it's saving money. Right now, as I said, heart disease costs our nation about $440 billion a year. We can reduce those costs. We can reduce those costs. And I might mention also smoking. Cigarette smoking also kills an estimated 173,000 women every year. If current smoking rates persist, more than 6 million kids, as I said, will die from smoking. Now, the new national anti-tobacco ad campaign is called, quote, Tips from a Former Smoker, end quote, is being supported by this prevention fund. I think many of us probably have seen these ads. They're extremely powerful and effective ads, and they're going to save lives. In fact, this ad campaign is expected to inspire 500,000 quit attempts and help at least 50,000 Americans quit smoking forever. I might just add that within 2 days of these ads first appearing, the number of phone calls to smoking quit lines tripled from people who wanted help in quitting smoking. I mentioned the immunization programs for kids. These investments from the Prevention Fund aren't just at the national level, they're also in our communities. This fund is helping states and cities and towns to implement evidence-based programs that meet their particular local needs. For example, in Illinois, the state has made improvements to its sidewalks and has marked crossings to increase levels of student physical activity. Because of these improvements, the number of students who are walking to school has doubled. Doubled. That's a good thing. So not only is this good for their health, it's expected to save the school system about $67,000 yearly on bus costs. In Mobile, Alabama, Mobile County officials enacted a comprehensive smoke-free policy expected to protect 13,000 residents and visitors from being exposed to secondhand smoke. This is Mobile, Alabama. So all across America, the Prevention Fund is investing in proven, locally developed programs that promote health and wellness. These evidence-based programs not only improve health, but, as I said, will help us save money in health care costs. According to a new study by the Centers for Disease Control and Prevention, programs like the National Diabetes Prevention Program could prevent or delay nearly 885,000 cases of type 2 diabetes, saving our health system about $5.7 billion over the next 25 years. The National Diabetes Prevention Program is a public-private partnership of health organizations working together to prevent the type 2 diabetes that the New York Times editorial was just talking about. And given that in 2007, diabetes alone accounted for about $116 billion in direct medical costs, it's critical that we continue these investments. Now again, here's how this investment's being returned. You might say the return on investment for public health spending. For every dollar spent on childhood immunizations, we save $16.50. Proven. Tobacco control programs, for every dollar, we save 5. For chronic disease prevention, for every dollar, we save $5.60. For workplace wellness programs, $3.27. So if you want to look at it just in terms of dollars and not just in terms of lives, we're saving money also. Mr. President, the Prevention Fund's investments in cancer prevention also provide an opportunity to save lives and money. In 2007, the direct and indirect costs of cancer, which accounts for nearly 1 out of every 4 deaths in the United States, totaled about $123 billion. Earlier this year, researchers found that nearly half of U.S. cancer deaths could be prevented, again, through the kinds of programs the Prevention Fund is funding today. Preventable U.S. cancer deaths, about 50%. Preventable diseases from heart disease, diabetes, and stroke, about 80%. This is what the Prevention Fund is going after. For the life of me, I've never understood those who want to get rid of the Prevention Fund and yet are willing to pump untold billions, trillions of dollars into patching, fixing, mending, surgery, health care costs down the line. Perhaps my friends on the other side of the aisle never learned that old axiom of Ben Franklin's, about an ounce of prevention is worth a pound of cure. Here, about an ounce of prevention is worth about 10 pounds of cure or more. Well, the list goes on. Recently, the Trust for America's Health released a study showing that a 5% reduction in the obesity rate could yield more than $600 billion in savings on health care costs over a 20-year period of time. 5% reduction. Studies such as this one confirm what common sense tells us, that prevention is the best medicine for our bodies and for our budgets. That's why nearly 800 organizations have spoken out against these misguided efforts to slash or eliminate the Prevention Fund. Mr. President, these organizations like the Young Invincibles, the U.S. Student Association, the American Diabetes Association, the Campaign for Tobacco-Free Kids have all said no, don't Don't cut, don't eliminate the prevention fund. Despite misguided efforts to cut or eliminate the Prevention Public Health Fund, most Americans understand what's at stake. Prior to the Prevention Fund, for every dollar spent on health care, 75 cents went to treating people with chronic illnesses, and only about 4 cents went to prevention. 75 cents taking care of people later on with chronic diseases that are preventable. Only 4 cents out of every dollar went to prevention. This underinvestment has had devastating consequences. Nearly half of American adults have at least one chronic condition. Yes, you heard me right. Nearly half of American adults have at least one chronic condition. And 2/3 of the increase in health care spending between 1987 and 2000 was due to the increased prevalence of chronic diseases. So if 2/3 of your budget, of the increase in spending, is on chronic diseases, and yet we can reduce those chronic diseases through prevention, you would think that you'd want to increase that 4 cents a little bit on the dollar that we're spending right now. This prevention fund gives us an unprecedented opportunity to bend the cost curve. How many times have I heard about bending the cost curve in medicine? The best way to do it is to prevent chronic diseases. The transformation of America into a true wellness society, a society that focuses on preventing disease, saving lives and money, is the most cost-effective way to proceed. So as we can see, to slander the Prevention Fund as a so-called slush fund is a shameful mischaracterization. This fund is saving lives and saving money. Eliminating this fund, as proposed by my friend from Tennessee, would be bad public policy, a serious case of misplaced priorities. The very idea that Republicans would slash prevention and public health so that a small group of high-income taxpayers can continue to abuse the tax code, I find simply unacceptable. Now, before I close my remarks, I'd like to address an egregious mischaracterization that I have heard from the other side of the aisle. Now, some Republicans claim that Democrats in our historic reform of the student loan program took money that had been going to students and used it to pay for the health care bill. I've heard that a lot of times. Well, again, that's simply not so. The reforms passed by Democrats in Congress, I might add over vehement Republican opposition, did not take a single dime from students. Instead, the bill eliminated wasteful taxpayer-funded subsidies to banks by converting all new federal student loans to more stable, reliable, cost-efficient direct loan program, redirected that money to students, to deficit reduction, and some important health reforms. So the money didn't come from students. The money came from the subsidization that we've been given to banks. Specifically, thanks to the huge savings generated by eliminating wasteful subsidies to banks, what were we able to do with that? We provided increases in the maximum Pell Grant award to keep up with inflation. We provided funding for minority-serving colleges and universities. We made a major investment in community colleges, creating a community college and career training grant program. We were able to make loan repayment more manageable by capping a new borrower's loan payment at 10% of their net income, and forgiving any remaining debt after 20 years of payment. That was all done by stopping this wasteful subsidies to banks and putting it into the direct loan program. And again, we provided more than $10 billion in deficit reduction. Now, at the same time, we were able to expand the community health center program to ensure access to life-saving medications and to expand vital consumer protections to millions of Americans with private health insurance, Protections that we put in, like banning lifetime limits, requiring dependent coverage, prohibiting cancellation of coverage due to an illness. In other words, thanks to the education reform bill, students benefited, the middle class benefited, taxpayers benefited, and health care consumers benefited. Had my friends on the Republican side had their way, and had those reforms been defeated, only the banks would have benefited. Now, indeed, I kind of detect a pattern here. When we Democrats were fighting to end this subsidy to banks so that we could dramatically increase college grants and loans for middle class and disadvantaged students, my friends on the other side of the aisle stood with the banks and did everything they could to kill the reforms. Likewise today, Democrats are fighting to prevent a 100% student loan rate hike. We want to fully pay for it by correcting a provision in the tax code that allows a small group of wealthy Americans to avoid paying some Social Security and Medicare taxes. Republicans are going to the mat to prevent those wealthy taxpayers from having to pay their fair share. Instead, how do they want to pay for keeping the interest rate down? By gutting the prevention fund, killing it, eliminating it. The very fund that's investing in initiatives to fight cancer and heart disease and to protect the health of our children, our women, and our elderly. Well, what they are proposing is bad public policy, is bad priorities. We need to be putting the middle class first. We need to be putting students starting to pay for college first. We need to be putting public health and prevention first. Put all those out there. To make these things possible, we should ask this small group of wealthy Americans to put their country first and stop abusing this provision, this loophole in the tax code. So I urge my colleagues to support the Stop the Student Loan Interest Rate Hike Act and to support the offset currently in the bill. 5 years ago, the original law that reduced the student loan interest rate to 3.4% passed with overwhelming bipartisan support and signed by a Republican president. I hope that we can find common ground to pass this new legislation with that same kind of broad and bipartisan support. That, Mr. President, I yield the floor.
Senator from Tennessee.
Mr. President, I'm glad I had an opportunity to hear the distinguished senator from Iowa, who's my friend, the chairman of the Health, Education, and Labor Committee. I want to address the same subject he did, but I want to hasten to summarize at the beginning to say we agree. By we, I mean Governor Romney, the likely Republican nominee for president, President Obama, the House Republicans, others, agree that for the next year, we should keep the interest rate on 40% of the student loans at 3.4% for new loans. We agree on that. There's not a difference of opinion on that. What's different is how we pay for it. And what the distinguished senator from Iowa has done is actually outline very well the difference of opinion here. What we're saying, what the Republicans are saying, is that in order to pay that $6 billion it costs taxpayers to keep that 3.4% rate the same for the next year, we want to give to students, we want to give them back their own money, the money that the Democrats are overcharging them on their student loans. Now, the senator from Iowa went through a very careful explanation from that, which was largely correct. He pointed out that at the time that the majority decided it would put make the Secretary of Education, the nation's leading banker, put him in charge of administering what's becoming to be nearly $1 trillion worth of student loans every year. In other words, take it away from the banks and make the government the banker, that there was about $61 billion in, quote, savings. That's from the Congressional Budget Office. The argument of our friends on the other side was those were unnecessary subsidies to banks. Well, let's say, Mr. President, for the moment, for sake of argument, that they're correct about that. That $61 billion is money that students were paying in interest on their student loans. So wouldn't the logical thing to do be to let the students keep the money? I mean, if you really cared about college tuition going up, student loans rising, wouldn't the thing to do be to say, we've done a big favor to you students. The government's been overcharging you on your student loans, all 15, 16, 17 million of you who have student loans. So instead of the rate of 6.8%, which it is for most students, we're going to lower that rate to 5.3%. Now, that's not my number. That's the number the Congressional Budget Office said, that we could take that $61 billion that our friends on the other side said the government's overcharging students, and we could reduce the average loan of about $25,000 to a 5.3% rate instead of 6.8%, and that would save the average student on the average loan about $2,200 over 10 years. But no, they didn't do that. They spent it on more government, $10 billion to reduce the debt, and $8.3 billion to pay for the health care bill. So what we're saying is, in order to freeze this rate at 3.4%, let's give to students the money that they were paying, and instead of paying for the health care bill, let's reduce the student rates with that. That's the difference of opinion here. Of course, our friends on the other side have a better way in their opinion. Not only do they want the students to continue to pay for other government programs and some money for the health care bill, they'd like to raise money in the middle of the longest recession we've had since the Great Depression on job creators. But let me go back to the beginning point here. We're talking about something that was reflected very well in the New York Times yesterday. I noticed the senator from Iowa talked about the New York Times. Here's the national section yesterday talking about what's going on in California. Angry about tuition increases and cuts in courses and enrollment. A dozen students at California State University have taken their protests beyond marches. They've declared a hunger strike. The fasting protest was the latest display of anger at the 23 California State University campuses. The system has lost roughly $970 million in state financing since 2008. Now, Mr. President, the University of California is probably the best public university in the world. It's lost nearly $1 billion in state funding since 2008. And the students are fasting. They're upset about the tuition increases. Why are the tuition increases coming? Well, the administrators say if we lose $1 billion from the state for our state universities, the money has to come somewhere to pay for excellence in our universities, so we increase tuition. That story's been going on all over the country. Why is that happening? I mean, the president's put this issue out on the table. I think we need to discuss it. Why are they fasting in California, protesting tuition increases? Why in Tennessee last year did state funding for the University of Tennessee and community colleges and Tennessee Tech go down 16%? Mr. President, the main reason is the federal government's health care policies, its Medicaid mandates on states that are soaking up dollars, state dollars, on Medicaid that would otherwise go to pay for public universities. President Obama did not start this policy. It's been going on for 30 years, but he's making it much worse with his health care law that was passed, and when it takes effect next year, the Kaiser Family Foundation says that states which already are spending 1 out of 4 of their state tax revenues on Medicaid will see a 29% increase in the cost of Medicaid funding. And what will that do, Mr. President? What that will do is force California and Tennessee and Connecticut and Iowa to look in their state budgets, to take the money that most likely would have gone for their colleges and community colleges and public universities and instead spend it on Medicaid. Those federal Medicaid mandates are soaking up money that would otherwise go to public colleges and universities, and as a result of that, the universities are raising tuition. As a result of that, loans are up, students are fasting, and the president's on the campaign trail promising to fix it. Well, let's talk about his fix. First, it is the political season, and so students as well as senators and all of us need to listen very carefully when someone begins to stir the crowd about a popular issue. And surely being able to pay for college is a popular issue. We hope that all American students who want to go to a higher education will be able to go, will be able to afford to go. And our federal government goes to great efforts to make that possible. Half of the students who go to colleges and universities in America, and there's 6,000 of them of one kind or another, have a federal grant or a loan to help pay for college. We have more than $100 billion in new loans going out this year. That's from the American taxpayer. That's from people who are out there working and paying taxes, the UAW member, the teacher. Their taxes are going to loan $100 billion to students this year. And the amount of money for Pell Grants this year is $41 billion more dollars in grants. I mean, at the University of Tennessee in Knoxville, a fine campus where the tuition is about $7,200 a year, which is still a good bargain, I would say, at a great university. Almost all the students show up with a $4,000 state scholarship called the Hope Scholarship, but for the quarter of those students who are low income, they have Pell Grants that carry them above the amount of tuition. So state and local governments have made a great effort to try to make it easier for our young people and older people to continue their education, and we want to continue to do that. There's a bipartisan effort on that. Now, the specific issue at play here, and the one we're likely to vote on tomorrow, has to do with one type of those student loans. And let's try to put that into perspective. If either version, the Democrats have a version and Republicans have a version, I'm offering a version which would pay for it by giving back the students the money that the government's overcharging them. The Democrats have one that would raise taxes on people who create jobs, but whichever one were to pass, if one were, here's what it would do. It would save students on new loans about $7 a month in interest payments for the next 10 years. Now, that can add up. That could be $80 in a year, $800 in 10 years. But that's what we're talking about, $7 a month in savings, $7 a month in interest payments on the average loan. And that's for 40% of the loans, and that's for new loans. So if you've got a student loan and it's at 3.4%, that's not going to change. 40% of people do have student loans today at about 3.4%. Everybody else is at 6.8%, which is a good deal lower than you could get a private loan. Private loan being one where you just go into a bank and say, I'm going to college, I don't have a job, I'd like to borrow some money. Maybe you can get it, but they're going to charge you more from that because you might not be able to pay it back as well as somebody else. So we've agreed on this. At least we've agreed on the policy, not how to pay for it. The President has agreed on it. Governor Romney has agreed on it. For the next year, we'd like to take these 40% of the loans and keep them at the 3.4% rate. And then later in the year, earlier next year, when we look at our entire budget, how much money we've got to spend, the size of the debt, which is of great concern to all of us on both sides of the aisle, we'll see what we can afford to do. So that's the first question. But I'm glad the President has been going to college campuses. I'm glad he's raised the issue of student loans and college tuition, because as a former governor of Tennessee who cares deeply about education, as someone who was also United States Education Secretary about 20 years ago, I've been trying for 20 or 25 years to get Washington to pay attention to the idea that it is ruining our public colleges and universities with these Medicaid mandates that soak up the dollars that ought to go for public colleges and universities. 3/4 of our students go to public universities like the University of Tennessee or Iowa State or California, or to the community colleges, which are really our secret weapon. And even with a rising tuition, those costs are at least reasonable now. I mean, tuition at the community college in Tennessee is about $3,000. Nationally, the average tuition to four-year public university is about $8,200. It's not easy to find the money for that, but it's still within range. But what has happened in the last 25 years? Well, I can tell you what's happened in my state. I visited with the retiring president of Tennessee Tech University, a fine engineering school. He said two things. One is, over the last 3 years, state funding for his university, and for most in Tennessee, has gone down by 30%. Now, that's not a 30% reduction in the rate of growth. That's a flat-out cut, a flat-out cut. And why has that been happening? Well, our governor, the current one, and our former one, a Democrat, both have said what I know, and every governor knows, is that when you make up your state budget and you get down toward the end of it, you make a choice between Medicaid and higher education, and because Medicaid is run from Washington with specific mandates, the states end up having a stranglehold on them, and in effect, if they participate in the program, to be forced to make decisions about eligibility and how much they spend, and there goes the money. There goes the money, and there it doesn't go to the public colleges and universities, and less money, higher tuition, higher loans. Now, the fasting students in California, if I walked up to them today and said, I'll bet you didn't know that President Obama's health care policies are the reason you're hungry today, they wouldn't believe that. But the fact of the matter is, not just the president's policies, but the policies over the last number of years have gradually soaked up money that would make the University of California a great university and left it no recourse but to become more efficient, which it should, and to raise tuition, which it is doing. To give you an example of how much difference this makes. In the early 1980s, I was a young governor and I was making these budgets up, and I would say, well, about this much goes to K through 12 education, and then the courts are running the prisons, so I'll have to put that in, and then the gas tax goes to the highways, and you get down toward the end of the budget and you make this choice between Medicaid, the federal program that states pay about 37% of, something like that, and I was trying to restrict funding for Medicaid and increase funding for education. I could see where we were headed over the next several years. So I went to see President Reagan. I made an appointment, so I'm in the Oval Office. I said, Mr. President, let me propose a grand swap. He said, what do you mean a grand swap? I said, we'll swap you K through 12. We'll take all of K through 12 education, we in the states. You take all of Medicaid. And he thought for a moment, said, well, that sounds like a pretty good idea. My reasoning was that instead of Medicaid having two masters, one in Washington and all the different governors, if it had one, it'd be managed better. If Washington ran it, Washington would have to pay for it all, and it would make sure that it could fund it. And I thought then, and I think today, that almost all the responsibility for kindergarten through the 12th grade belongs closest to the child as possible, first with the family, then with the classroom, then with the state. And I believe that while there's been some important advocacy from Washington over the last 30 years, that if we made that grand swap 30 years ago, the Medicaid program would be run better today and our public schools would be better today. Well, we could argue about that, but the one thing we wouldn't argue about is the difference in money. Back then, if we'd made the swap, the states would have come out ahead by about $4 billion. In other words, the federal government would have taken over Medicaid, the states would have taken over K through 12, given back to the federal government the federal aid to education, and the federal government would not spend its Medicaid money. $4 billion was the difference in 1981 or 82. What would the difference be today if we made such a grand swap? $92 billion, Mr. President. $92 billion of extra money the states would have if today the federal government took over all of Medicaid and the states took over all of the responsibility and funding for K through 12. That would mean in a state like California, where the students are fasting, California would probably have 12 or 13 billion more dollars. And do you think much of that would go to the University of California to continue its excellence? You can be sure it would. Would much of it go to Tennessee Tech and the University of Tennessee and the community college? You can be absolutely sure it would. So what has happened over the years is that these well-intentioned federal health care Medicaid mandates have put the stranglehold on governors, which is why I said when we were debating the health care law that I thought any senator who voted for it ought to be sentenced to go home and serve as governor for 8 years and try to implement it. I mentioned in Tennessee last year that state funding for higher education went down 15%. Well, guess what? State funding for Medicaid went up 16%. So there's a direct relationship. Medicaid up, state funding for public universities down, tuition and loans go up, and that's the real problem we have today. So I'm glad the President has put this issue on the table. I'm glad he's talking about it. And I hope Governor Romney talks about it. And I hope what they agree to do is either to repeal the health care law or to repeal the Medicaid mandates and give states more flexibility. You can't pass a law in Washington, as we did 3 or 4 years ago with the Stimulus Act, and say we're going to give you more Medicaid money, but, Mr. Governor and Ms. Legislator, you can't reduce state funding on Medicaid. Lieutenant Governor Ravitch of New York, a Democrat, wrote an excellent article in the Wall Street Journal at the time and said, if you tell New York that at a time where we're reducing revenues and you say you've got to keep spending on Medicaid, we have to cut something else. The State University of New York gets cut. So New York cuts the State University of New York, tuitions go up, loans go up, students are protesting. And it's not just the student protests I worry about. We're at a time in our history when we're in serious competition around the world in a brain power competition. We have a lot of Chinese scholars going from American university home again to their universities. We did in a bipartisan way, and the senator from Iowa was a part of it, and we passed something called the America Competes Act a few years ago and reauthorized it so we could properly fund our science and our innovation. Government-sponsored research has been an important part of our job growth over the last 30 or 40 years. And where is that done? It's done at our national laboratories or at our great research universities. Well, at least half of our great research universities are public universities. They're like the University of California, the University of Michigan, the University of Tennessee, the University of Connecticut. And if we cut that government-sponsored research and the quality of those universities, our job growth won't be nearly as good in the future. Here's another example of how much that has changed over the years. 30 years ago in Tennessee, the state paid 70% of the cost of a student to attend a state university, and the student paid 30%. And we had an implicit agreement between the government and the student, and we said, if we increase your tuition, we'll increase by the same percent the state contribution. So we kept it at about 70 and 30, and it made it possible for a lot of students to go to college. What is it today? It's 30 and 70. It's upside down. 30% of the support for public colleges and universities comes from the state government, and 70% comes from the students. And why is that? The fact is, Mr. President, the main reason is federal health care mandates that put an unrealistic amount of money on top of states. And it's about to get worse. I mentioned earlier the Kaiser Family Foundation estimates that next year, states that are already spending $1 out of every $4 for Medicaid will see a 29% increase in Medicaid funding. This fast will have to go on a lot longer in California if that's going to happen. You can't cut $1 billion out of the University of California every 3 years and have it remain the best public university in the world. It's just not going to happen. And you can't raise tuition 6 or 8% every year and make college available to the large number of students that we would like to go. So I'm glad that the President and our friends on the other side in this political year have raised the issue of rising tuition and student loans. We agree on the little issue before us. We'd both like to take that 3.4% interest rate, extend it for a year. That costs $6 billion. That affects new loans. It affects only 40% of the students, but we agree on that. The President does. Governor Romney does. That's not an issue. The issue is, do we raise money on job producers, or do we give back students some of the money we're continuing to overcharge them on student loans? That's the issue. But the larger question, and one which I hope that we all address this year in our debates, and that the President and Governor Romney address in their debates, is what about the future of our public colleges and universities, where 3 out of 4 American college students go? How are we going to maintain their quality and maintain the opportunity for access to them if we continue to impose on states Medicaid mandates that soak up the money that ought to be going for excellence in higher education and the greatest amount of opportunity for students by keeping tuition rates low. That's the real issue. And while President Obama is not responsible for what went on before he became president, he has made that condition much worse. And if he's going to bring this up on a campaign trail, I hope he tells the rest of the story, which is that he himself and his health care and Medicaid mandate policies are a principal part of the reason, and I would say the main cause, going back over the years, to the reasons why California students are fasting, Tennessee students are looking forward to an 8% increase in tuition, and all across the country, college presidents know very well that the reason there have been such reductions is because of federal Medicaid mandates. I hope, Mr. President, we have an opportunity not only tomorrow to vote on the Democratic proposal to keep student loan rates at 3.4%, but also on the Republican interest rate reduction amendment that I have proposed, which would keep the rates at 3.4%, but pay for it by stopping the overcharging of students to help pay for the health care law. Mr. President, I thank the President and I yield the floor.
Mr. President.
Senator from Arizona.
Mr. President, first let me say I very much appreciate the comments of the Senator from Tennessee and his leadership.